morning, everyone. My name is Dan McLaughlin. I'm a Senior Executive Fellow in the Opus College of Business here at the University of St. Thomas. On behalf of our partners, Clifton Larson Allen and Frederickson Environment, it is my honor to welcome you to this morning's Future of Healthcare webinar. Thank you for joining us. Before we get to today's session, I would like to cover a few logistics. This is our second in a series of 6 monthly webinars we'll be delivering to replace our day-long annual Future of Healthcare conference. Our next webinar will be on Friday, January 15th, when we'll be welcoming Jennifer DeKubelis from Hennepin Healthcare and Dr. Tony Eaton from the California Endowment. They will discuss what their organizations are doing to combat some of the negative social determinants of health. Because Dr. Eaton lives in California, our January webinar will be delivered at noon Central Time. In a few business days, you will receive an email with links to the recording of today's session and the registration page for our next webinar. A link to that registration page will also be provided in the chat feature of the Zoom session. For our agenda today, each of our presenters will give a brief presentation. Our first presenter is Jared Mueller. Jared is director of the Mayo Clinic Innovation Exchange. In part, his role includes bringing experts and healthcare entrepreneurs together to launch breakthrough innovations in the market. Jared's career spans the Boston Consulting Group, Obama Foundation, a software as a service company, and a White House appointment working on economic and entrepreneurship policy. Our second presenter is Sheila Krocak. Sheila is a serial entrepreneur who has focused her career on developing and deploying new business models for large enterprises. Her focus on combining technology and service to deliver differentiated and impactful experiences has changed how customers engage with organizations. She has been instrumental change agent for Best Buy, leading the senior living business vertical for Best Buy Health. Following their presentations, we will spend the remaining time in Q&A. For the Q&A portion of today's webinar, I will be joined by Vineet Pandey, who is a member of our conference planning committee. Vineet is an executive in Accenture's health strategy and consulting practice based in Minneapolis. He is passionate about helping health systems and hospitals in the areas of innovation strategy and digital front doors. He also leads the health innovation ecosystem for Accenture in the state of Minnesota, where he acts as the innovation bridge between startups and clients. We will also be taking questions from you. Please use the chat feature to ask questions at any time during the session. Just address them to all panelists. We will hold questions until the end. Our goal is to end before 9 a.m., so you have time to transition to your next meeting. It is now my pleasure to welcome Jared Mueller.
Well, thank you, Dan. Can you hear me all right? Wonderful. Again, Dan, thanks, and thank you for the opportunity to join Sheila and meet with this great group today. I'll intend to keep my remarks pretty short because I'm excited to hear about Sheila's work and to begin the discussion. Please let me know if folks can't see my slides, but as Dan mentioned, my name is Jared Mueller, and I'm the director of the new Mayo Clinic Innovation Exchange. For some brief background on Mayo, knowing that this is a Minnesota dense group and you don't need the full story on Mayo, we're an academic health system with a team of nearly 70,000 people, providers, researchers, and allied health staff and others across physical campuses in Minnesota, Arizona, Jacksonville, across the Midwest, and also around the world. One kind of exciting element of this for us is Mayo has been obviously focused on innovation for more than a century, since Dr. Mayo started his clinic during the Civil War, and the future of healthcare has been on the top of mind of Dr. Mayo, the Mayo brothers, and in the pandemic has been even more of a priority for us. I joined Mayo in April, and it's been extraordinary to see the work that all of our colleagues have been doing. So to share a little bit about our team, and apologies if it takes a moment for the slides to advance, the Mayo Clinic Innovation Exchange launched this summer. And what's important about Mayo is every team at Mayo has a medical director. And our medical director, Dr. Charles Bruce, has lived this bewildering slide himself. He's a repeat innovator, a cardiologist who has more than 30 patents and has experienced the difficulty of bringing a healthcare innovation from the back of a cocktail napkin to a patient's bedside. A major reason why the Innovation Exchange was created is to help innovators, whether those are innovators within Mayo or entrepreneurs who are looking to engage with Mayo experts, to navigate these steps and to match them with experts who can help them understand the best approach or think through strategies at each stage of the journey. Some of those partners or those experts are partners at law firms. So we use philanthropic support that Mayo has received to support these entrepreneurs and cover their meetings with law firm partners who might be experts in HIPAA, business strategists like Vineet and others at Accenture who have experience working with the biopharma industry or in other areas whose expertise complements the expertise within Mayo Clinic. And then also marketing strategists who can help someone who might have spent the last few decades becoming an expert in the field, in their lab, think about how their business can truly grow and thrive. So a more concise way to describe that is we've created a platform that is really focused on providing support to innovators at every stage of their process. And the more participants there are in that platform, the more mutual value, whether it's a Mayo physician who learns about an innovative technology or a company that improves its product market fit, everyone will experience, and with the end goal of benefiting patients. So to briefly describe the exchange, since we've launched this summer, we've incorporated founders from around the world, and those founders have businesses that are headquartered in Singapore, Ireland, UK, and also all across the country. There's no state that has a majority of our members, and those founders and entrepreneurs also work with more than 240 internal members who span Mayo's 3 US academic medical centers and the broader Mayo Clinic health system across the US and the Midwest. So there's a lot of enthusiasm for these kind of productive cross collaborations. To talk about our resources and recap those, as I mentioned, we have excellent, and here, let me shoot back a slide if I can. We have excellent educational partners in Georgia Tech, Florida State, and the University of North Florida who work closely with our neurologists. We have computer scientists who help develop new tools for neurosurgery and rehabilitation, and also have powerful top-tier resource partners in terms of Holland & Knight, the international law firm, and Accenture and Droga 5 to help experts in their fields understand how a new technology might be received by a payer or a provider or other key decision makers. I'll talk briefly about a few of our external innovators. As I mentioned, we have more than 20 innovative startups, and we have 25 members comprising those startups. So apologies if this is advancing automatically. I might actually shoot back a few slides. Sometimes we have this challenge on Zoom, but here, let's see if I can exit. To highlight again some of our internal members, which should be coming up on the subsequent slide. We have more than 20 internal innovative startups, and we wanted to share just a few of our highlights from those startups last month. So we had one startup that went public through a SPAC and Cloudbreak Health, which will be listed on the New York Stock Exchange next year under the ticker UPH. And then have been pleased to also see 2 of our startups succeed in statewide competitions in Florida and receive non-dilutive fundraising and funding support from statewide organizations here in Florida. Let me quickly share a little bit about one of our internal innovators. And I should say that we are limited somewhat in the information we can share about some of our internal work while the IP is still being developed. But Dr. Moreno Franco is the chair of the critical care here at Mayo Clinic in Florida. He has worked with a number of colleagues to develop a tool that protects providers from aerosol particles during procedures that might generate aerosol during the pandemic. This is the sort of project that we are eager to support and to work with corporate partners to incorporate in their own products, even if in some cases, some of these COVID priorities have perhaps modest revenue potential for Mayo, because obviously our philanthropic mission, both as Mayo and also specifically as the exchange, is to support patient care first. And it's been a joy for our team to invest hundreds of hours in these COVID priorities and to help advance some innovations that will keep Mayo patients, providers, and then their surrounding communities a little bit safer. And then the last point I wanted to mention is the priority of diversity and inclusion for everyone at Mayo Clinic, but especially for any team that has to do with innovation. There's been ample research from around the world that has shown that the US and the developed world has left trillions of dollars of economic opportunity on the table by failing to support innovators from underrepresented communities, innovators of color, women who are innovators, and innovators from all underrepresented backgrounds. That's obviously an area where we as a society need to do better, both for the innovators' sake, but also in the case of healthcare for patients' sake. We know that we will not be fulfilling our patient care mission if we don't double down on efforts to ensure that we are being especially welcoming to innovators of color and innovators from other underrepresented backgrounds. We hope that we have a chance to discuss this in the Q&A. This is a special priority for Mayo's leadership, for our physician leadership as an institution, and also represents an opportunity to ensure that that startups that serve underserved needs or underserved communities are able to catch up and be supported to benefit all patients. And then briefly, I wanted to mention some of the history of Mayo's work at which long precedes the development of our team, which was launched this year. So Mayo Clinic technology you can find it on every continent. We have more than 7,000 patents filed over the last 35 years and more than 2,800 patents issued. And then there are more than 200 startup companies that have developed based on Mayo technology. Those companies have employed more than 1,000 people. And that revenue that has been generated by that Mayo IP goes back to support our nonprofit and philanthropic mission in patient care. So apologies for the challenges in advancing these slides. Sometimes Zoom took on a life of its own and PowerPoint took on a life of its own, but wanted to wrap up and save a lot of time for Q&A, but would leave by saying, please don't hesitate to reach out to us at innovationexchange@mayo.edu or visit innovationexchange.mayoclinic.org. We're eager to engage with healthcare entrepreneurs or others who are thinking about how innovative small companies can help advance patient care and save lives around the country and the world. So with that, we'll stop the presentation and look forward to hearing from Sheila.
Jared, thank you for your presentation. We've received several questions for you, but we'll get into the question and answer after we hear from Sheila Krocak. So Sheila, we look forward to your presentation.
Excellent. Thank you, Dan and Jared. Super exciting to hear about what is happening here in Minneapolis and what's happening across the world. And particularly what I'll talk a little bit about today is what in the world is Best Buy doing at a health conference, which people may be a little bit surprised about. What do we feel we're bringing to the table, and where do we see opportunity to uniquely serve? And then I'll also talk a little bit about the impact we've seen from COVID. And then we really, as Jared said, what we'd love to do is have a lot of room at the end of the conversation for questions. So this is maybe what people think about when they think about Best Buy, right? We're a retailer. We've been around for 50 years. We have 1,500 stores. We've been in the service business for 20 years. But what brought us to health? Well, when we think of, I think, Jared, I'm having your same challenge with advancing my screen. When we think how we got into health was when we think about our mission, which is on the next slide, if I can get this to advance here. Our mission is really about serving people with technology in their home and enabling their lives for a better experience. And so we'll put our mission statement up here. In our mission statement, is really about we dream of a Best Buy that truly helps customers pursue passions with enriching lives with the help of technology. And when we think about technology, we think about it more broadly than just selling people refrigerators or TVs. We think about it in terms of solving human needs, the need to entertain people in your home, or the need to be productive, or the need to have food and outfit your home. And health and wellness was an established need that we had started about 7 years ago. And when you think of Best Buy, our traditional position in health and wellness has really been a predominant player in the wearable market. And so one of the things that we do as a retailer is we are rooted in consumer data and consumer need. And what we started to see was people coming into our stores and consumer data that was really pulling us into this space and thinking about, how do I use data and wearables to keep myself healthy? How do I think about smart home technology to maybe help an aging parent? And so we decided that this was probably a space that we wanted to participate in. And we also thought about, what are the changing consumerization trends happening in healthcare? And so we saw things where patient with the change from fee-for-service to value-based care, all of a sudden payers and providers needed to operate and think more like consumer-focused people. It wasn't just about, how do you deliver care, but how do you think about that journey map and how do you think about that experience? And where consumers have more options based on deregulation. And we just saw an explosion of the need for technology in the home. And so what we saw was a move from a passive patient to an active consumer. We saw disruptive consumer technology that was continuing to accelerate, and we saw consumer data that was saying, hey, Best Buy, we really are looking for you to provide these solutions. So when we thought about, as we zoomed out, well, what are the capabilities that we have that are relevant in this space? And how the way we like to think about it is we talk about touch plus tech. So tech is important, but if you don't have, we believe if you don't have those service wrappers and really help people get the most of their technology, one of the things that I've seen with the explosion of technology with COVID in the senior living community is in the early April or early parts of COVID, people wanted to do a lot of FaceTiming with their loved ones. But when it didn't work just to ship a bunch of devices to a resident community without understanding what's their Wi-Fi, what's their level of experience. And so it's really about how do you bring that broader service to make the right experience. We also see a large fragmentation in the market. So when you think about just bringing technology into the homes of people, there are localized providers, but there isn't really anybody doing that at scale within the health industry. We also saw a pretty predominant pain point from payers and providers saying, I don't want to be, in the tech business. I want to be able to prescribe tech potentially, but I want to focus on delivering care, not the devices and tier 1 tech support that comes along with it. So that's where we started with our need. And from there, we thought about, so what group of folks can we service first? And when you think about 10,000 people a day in this country turning 65 and 90% of those people wanting to stay in their home, seniors seem like a really good spot for us to start. Again, in our smart home category, we were seeing people try and buy solutions around door locks and lights and monitoring to think about how do I know that my loved one is safe? And so we really focused in on this market. And in 2018, we made our largest acquisition ever. We purchased a company called GreatCall out of San Diego, California. It was almost $1 billion acquisition. And they sell a lot of products. So we acquired a lot of products through that, jitterbug phones and flip phones and PERS devices, the device where you can press a button if you have fallen or you need assistance. We also have monitoring systems. But really what was important about this acquisition for us was their caring centers. So as part of this acquisition, we acquired 3 caring centers that are US based, that are specifically trained in serving seniors. So they've gone through sensitivity training. They wear simulated glasses to see so that they can understand what it's like to have glaucoma. They wear gloves in their training to understand what it's like to lose the oils in your feet, in your fingers, and not be able to successfully touch your cell phone. And so we really felt like owning that last mile of service, what was something that was going to be differentiated to us. I would compare this for us to our acquisition of Geek Squad in 2002. And we believe that this business is going to be as critical for us as Geek Squad has been. As everybody has seen, COVID has dramatically changed the playing field. So I was actually doing some partnership work with Mayo about 2 years ago, and we were talking about hospital at home and the need for the tech and services in the home. And that business model had been worked on for about 10 years, but really hadn't seen mass adoption. Certainly with COVID and the challenges around aggregating in person, we saw just an explosion of tech in the home to help people connect to those they love, whether that's connect to their residents, if you're in a care facility, whether that's connect to your provider for a telehealth visit, or connect really the biggest demand we saw this year was how do I connect with my loved one if I can't physically see them? And so that's been a big focus for us. And we see, providers seeing telemedicine becoming critical. And in senior living, we see an occupancy challenge and just quite frankly, an expectation that there are technology services available. So that's what we've seen as a result of COVID. And we think that those changes are here to stay. And so really accelerating the work that we're doing. We continue to add assets and capabilities. And this is one of my last slides. So I'm anxious to open it up to questions and hear what you think about the work that we're doing. And so one of the more exciting acquisitions we did about 2 years ago was a company called Critical Signal Technologies out of Novi, Michigan. And what was really exciting about this is that they were in managed care. So they had monitoring contracts with Medicaid population and Medicare Advantage contracts. And one of the unique things that we're really excited about is social work services. So in addition to our emergency services that we acquired and rolled up with GreatCall, we also then were able to couple this with social work services. And as you can imagine, these social workers connect with our aging population and our consumers to help them find whether they have food insecurity or whether they need a ride to somewhere. And they will really help them connect with those services in their local area to address the social determinants of health that can be so critical in someone's well-being. As I mentioned, we have a PERS device, which is a personal emergency response device. We continue to invest in telemonitoring, and we really think a lot about the stakeholders around the senior and the older adult, and how can we enable those connections and help everybody stay connected and stay safe. I will open it up for questions and excited to hear what you think about the work that we're doing.
Sheila, Jared, thank you so much for the wonderful presentations. That was incredible just to hear your perspectives. If we were in person, I would be doing a standing ovation, but for now, just doing it virtual. We've got lots of different questions, just as a little bit of context. We will be addressing questions, send them our way as all panelists. Dan and I will alternate asking Sheila and Jared as many questions as possible before we reach the top of the hour. We've got plenty of time for that. So why don't I get started with the first question for Jared? First question here is, can you expand on how you seek out diverse or previously marginalized voices to engage in their innovations?
That's a great question. And it's something that we actually have a small team, and one team member, it's her top priority for both this year and next year. And I think part of it is being very intentional and reaching out to not just diverse groups of diverse inventors or entrepreneurs, but also investors who are focused on and championing diverse entrepreneurs in the healthcare sector. So there are a number of venture capital firms that have emerged in recent years that only invest in companies that are founded by women or are founded by immigrants to the US or founded by folks from one traditionally underrepresented community or another. And it's a brilliant investment strategy because the lack of historic underrepresentation and unwarranted lack of support means that there are really talented innovators and entrepreneurs who are poised to make a difference in healthcare. So Mayo, has decades long, if not longer, commitment to embracing diversity. Mayo was founded by an immigrant to the U.S. in the 1860s, and there has a long heritage of looking across the world and underrepresented founders in the U.S. To help advance healthcare and patient care. But we know that as an institution, we need to double down on our work, that society hasn't moved far enough, fast enough. And we're thrilled to do that, both through kind of a targeted marketing efforts, but then also just pounding the virtual pavement and talking to as many leaders as we can to help us identify really strong founders and innovators.
Sheila.
Yes.
Where do you see the biggest demand for the market? What services are you asking for? What are they asking for?
Yeah, that's a great question. So I would say, especially in the early days of COVID, the demand for deploying tech in the home and helping ensure people understand how to use the tech and connect to their providers was almost more than we could keep up with. We also then had to solve for the challenge of not being able, one of our largest assets is our Geek Squad agents that are 20,000 strong that can go into most of the United States in residential areas. But in COVID times, we had to quickly pivot to a remote model or a virtual model. And so we were able to do that successfully. But really, it's about how do the biggest demand that we are seeing is how do we help be that glue between the payer or provider that wants to use technology either for health or wellness or condition management, and the end consumer. And that's really where we have a strong suit and where we've been asked to play. Thank you.
Sheila, thank you. Jared, here's the next question for you. How can I, as a startup, look to apply to the Innovation Exchange? What does Mayo look for in a startup in their business model? How is it presented? PowerPoint, maybe some of the tactical unveil, sort of behind the scenes, how that all works. Can you talk to us a little bit about that?
That's a great question. And even though PowerPoint can be tricky, as today reminded us, we do oftentimes like to see a deck before, or a business plan to better understand how a startup wants to advance patient care. What I would say is reach out, even if you feel like your idea isn't fully packaged. Please email us at innovationexchange@mayo.edu and let us know about what you're working on. I'd say, we obviously have to triage and have a small team, so have to identify what companies are likeliest to get the most traction in terms of ability to get support from Mayo experts in their area. But we never want to wait and have a conversation when the company feels like the deck is on version 11 and it's airtight. We'd rather engage now, learn about what you're doing. Again, we're lucky to be an organization that has patient care as priority number one. And the reason why we want to learn early is if you're working on something that could save lives 3 months earlier, if we have a conversation or a member of our team has a conversation with you in December rather than in Q1 2021, it's better to just hear from you. And then, if you have something that has a lot of validity, the deck can come later. So please reach out.
Okay, here's a question for Sheila. You're getting a lot of kind of clinical questions here, Sheila, so you might have to go back to medical school. I'm not sure. Adult daycare programs have struggled to provide the need for interaction with clients and caregivers. It seems that was so much resources provided for schools, but nothing for seniors who are isolated in their homes. Question is, how can you reach out with user-friendly tech for people with dementia?
Yeah, that's a great question. I think there's a couple of different things in there. First and foremost, I would share the sentiment that there has been rightfully so, a tremendous amount of focus on schools and the need for supporting schools. I would also affirm that we see a tremendous need around supporting older adults, particularly in community living, and helping them connect to loved ones and through the use of technology. As it relates to dementia specifically, one of the other assets that Best Buy has, much like Mayo, we have a lot of innovators and startups and vendors coming to us every day. And so we are able to do curation of new products and services and memory care, not in terms of clinical memory care, but helping someone that either cares for someone with dementia or has cognitive concerns is an area of focus for us. I would say we're early innings in that area, but there is just an amazing amount of innovation that we're seeing from startup companies. One of the things that, like I'm sure Mayo does, that we like to help our partners do is vet out how do you bridge the gap between an early stage startup that has an amazing idea and bringing that to the market in a way that is scalable and doesn't crush that startup, right? And so those are some of the things that we're doing right now. And I would say, as it relates to dementia specifically, again, we're early into that work, but there are some really exciting solutions, both on the consumer level and the commercial level, that will be coming to market.
Sheila, thank you. So next question is about, I think it's getting to Jared on your side, the internal innovators. We're getting a few questions about COVID-19, one around the Mayo Clinic using convalescent plasma for the treatment of COVID. Would be interested to hear from your perspective, the intersection of the Innovation Exchange and the COVID-19 efforts that you're working on, whatever you're able to share, of course, acknowledging that a lot of it may be proprietary.
Thanks, Vineet. Yeah, I'd say we as an institution are working to support every corner of Mayo that is engaged in the COVID-19, the SARS-CoV-2 effort in terms of both treating current patients and working to find therapies and solutions that will protect people going into the winter in 2021. I would say that our team has been very focused on working with internal innovators, as you mentioned, who might be coming up with ideas about how to make the patient's journey more comfortable, safer, both within Mayo and in their daily lives. So without going into specific innovations, I think we've been really lucky to have at Mayo a broad array of collaborators with the Department of Engineering that loves working with physicians and getting into the maker space and 3D printing some prototypes of a tool that hasn't been invented before and that we might get approval to start using in a Mayo facility and then share with health systems around the country. So I would say that our team, because of this kind of tinkerer heritage and this role sitting at the juncture of a lot of other teams that are all trying to figure out how to make a difference, and we've been more on kind of that device or technology-enabled side, and a little bit less on the developing, potential therapies or vaccines. In part because Mayo has long-established groups that don't need the help of a team that's about 6 months old. They know what they're up to. So.
Another one for Sheila here. As a caregiver, I'm both delighted and surprised about Best Buy's involvement in senior technology services. How are you promoting these new technologies and services? Are you focusing on serving customers, I think your existing customers, or targeting senior living facilities?
Thank you for the question. I would say it's both. So we have, with the acquisition of GreatCall, that company had served about 1 million seniors with their products, with the phones and the personal devices and the emergency services. We will continue to. We've actually just rebranded that into, it's called the Lively brand now. So you will start to see more and more about our Lively brand products and services direct to consumer. So I think you'll see that more prominently on our website. You'll see it more prominently in our stores. You'll see us continue to build out that assortment, right? So it'll be more than just those initial products. And then my role within the organization is specifically serving our 1,000, we have 1,000 communities that we serve, over 100,000 older adults with our services and device products and services. And those run everything predominantly in the safety category. So nurse call buttons and the personal emergency devices, as well as we service the affordable housing community with safety services as well. And so again, we are early into this journey, but it's almost challenging for us to keep up with the demand. Where we see the most demand going forward that we're actively working on is continuing to develop out our app that links loved ones with their older adult or caregiver, mom, dad, whomever, so they can see, is mom up to date, and is she moving less than she was moving maybe before? Is there a way for me to quickly, take some of this data to her provider? And so really we're building out those robust services for caregivers and those who love seniors is the next foray that I think you'll hear from us about, in addition to telehealth. So telehealth is a big focus for us as well.
Great, Sheila. And speaking of cutting edge innovations, here's a question for Jared. Mayo has recently implemented a quite innovative program in a few of their markets this year that provides for acute level of care in the home, Mayo's Advanced Care at Home. Are there plans, Jared, for rolling this out in more markets in the near future?
Thanks, Vineet. And that is a great question, and also makes me want to back up a little bit and share a bit about 2 key hires that Mayo made last winter before the pandemic. The first is Dr. John Halamka, who's our new president of Platform. And the second is Rita Khan, who herself is an Opus College of Business alumna and Best Buy alumna, and is Mayo's first ever chief digital officer and the head of our Center for Digital Health. So they're driving a number of important telemedicine and digital health initiatives. The goal with the Advanced Care at Home initiative is to deliver high quality acute care in non-traditional settings like patient's home. And some of our other physicians describe it as a virtual 8th floor of the hospital. If you imagine 7 traditional floors, that it's allowing us to expand our footprint. Those innovations were important pre-pandemic in terms of improving patient experience and care, but are especially important when the health system experiences these surges in demand, and when allowing for lower density within a traditional healthcare setting is supportive of both patient outcomes and also the overall system's functioning. So I know that we are out in 2 markets with Advanced Care at Home, and are exploring where else that model might be most effective. I couldn't tell you off the top of my head what's next, what city or market might be next, but it's been a major source of excitement for Mayo. And as Sheila mentioned, Mayo collaborates with large companies and small companies all the time, and some of these corporate, including Best Buy and some initiatives and some of these corporate partnerships are what have allowed us to trial projects like Advanced Care at Home. So thank you for the question.
Thanks, Jared. It's really fun to hear these 2 big Minnesota companies and the intersection of the things that are going on. I'm just thinking, when we planned this seminar, we thought that there would be kind of interesting, kind of different ways of looking at the same problem, and it's kind of coming to pass here. It's just great, I think. All right, here's another question, Sheila. How are you working to reduce symptoms neglect? Patients are now presenting within the medical oncology profession, showing up with stage 4 disease due to perhaps unnecessary fear surrounding COVID. There's an interesting clinical question for you.
So this is something where we see, just a tectonic shift from last year. When I was first put in charge of the senior living vertical last January, my thought about, oh my goodness, I'm going to sell technology to senior living communities. No one's going to be interested. Well, after COVID, nothing could be further from the truth. And so we do see an incredible demand for how do we help. Traditionally, senior living has been a very, I would say, more of a real estate development type of business, right? It's closer to hospitality than it's been to healthcare. It's more about, how do you create a great environment and create things that are engaging, but really there had historically been a demarcation away from, anything related to healthcare. And what we see, just quite frankly, from a business need perspective in our senior living communities is that, as we're all aware, occupancy rate is moving down. People are taking loved ones out of community living or reticent to put someone into community living. And so, and part of that is, how do I make sure that that person stays safe? So we see an increasing demand for how do we have provider-like services in the senior living community? How do we enable that so that someone doesn't need to go to a physical hospital if they're afraid of that, and doesn't advance their condition because they were afraid to go to the doctor or to the hospital? And so that's technology that we're working on right now, and working with our senior living communities in connecting that gap around has historically been a very hospitality focused business into more of a healthcare, telehealth, virtual care enablement than we've seen ever before in this market.
Great, Sheila. Question for Jared around innovations for well-being of employees, but I think what these couple questions that are flurrying in around this topic are really about more broadly like mental health for patients, for employees alike. In fact, according to some Accenture research, a full 81% of consumers diagnosed with or experiencing a behavioral health condition definitely or probably would engage in a virtual channel. So Jared, what innovations are Mayo engaged in to support the well-being of their employees, behavioral health? Maybe talk about a little bit of those types of technologies or things that you're reviewing in your startup pipelines.
That's a great question. And there are a few ways that we approach that as an innovation team. So we, for example, are really proud as Mayo employees of the resources that Mayo makes available, obviously employee assistance programs and a few other channels to support Mayo employees who are struggling. And just to say, it's obviously been a tough year for people across the world. I know I've lost a family member to COVID. I'm sure there are others on this call who've lost family members either because of the disease or, as the last question pointed out, because the disease has complicated healthcare for other conditions. The pandemic has complicated healthcare for other conditions. So it's a huge priority for Mayo in terms of our own workforce of close to 70,000 people who are trying to help society get healthier and individual patients get healthier. It's also important for us in terms of our entrepreneurs. So we have the fortune of working very closely with some innovators in integrative medicine and in wellness who have been working closely with and giving sessions to our entrepreneurs in terms of if you have a startup and you're worried about the economic conditions that we're confronting and the volatility in capital markets this year, and your customers not returning your calls because they're putting out their own fires. How do you ensure that your mental health is strong? What are tactics you can do if you're you can pursue if you're socially isolated? How can you take care of your own mental health? So there are technology solutions. There are medical best practice solutions, and then there's also the commitment of employers and larger employers like Mayo to double down on their investments in resources for their own teams to ensure that the providers who are trying to keep others healthy are themselves healthy and able to deal with the stressors of a very challenging year.
Thanks, Jared. So here's a kind of a broader question. So what has been the biggest challenge you've encountered entering the healthcare industry? And kind of related to that is the culture question. So you kind of got a healthcare culture and you've got a retailer, electronics firm culture. And how do you see those two pieces kind of coming together?
Oh, that's a great question. So there are things that we had to solve for that we just weren't engineered originally for. So think of things like HIPAA, right? So our systems were not designed to protect data. In fact, it's almost the opposite of from a need to know basis. Our data flow is we want to know as much about you as a customer so that we can anticipate your needs and serve you better. The way that data flows in relation to HIPAA is much different. Fortunately, because of our very stringent PCI requirements around data privacy of credit card information and traditional privacy, we have a really robust infrastructure to be able to now pivot to handle HIPAA, but that was a very big consideration for us. The culture piece is interesting. I think what we bring to the table, as I mentioned before, is this obsession around what is the customer experience? How does this come to life for the customer? Where does it fall apart for the customer? And we've seen healthcare companies really be interested in that philosophy. Where I think there's a little bit of friction is we are used to moving really fast. We're used to being able to come up with an idea, and a long project for us at Best Buy is a 12-month project or an 18-month project. We have learned very quickly that that's a fast project in healthcare for the right reasons, right? This is not like bringing a TV to market. This is impacting people's lives, so it needs to be well vetted. It needs to be, go through all the proper channels. But for those of us that are retailers at heart or in our DNA, it's been a bit of a culture shift to acclimate to the different type of speed at which the industries move.
Sheila, that's a great point. It inspires me of a quote I've heard: "We're moving at the speed of healthcare." So welcome to healthcare. Jared, maybe on the flip side, has the pandemic affected the way multi-site institutions like Mayo interact with the corporate and startup communities? Have you had to shift from moving at the speed of healthcare to maybe at the meeting at the pace of where non-traditional players like Best Buy are moving? Thoughts there?
It's a great question. I would say that one way that it has allowed us to move more quickly is that there isn't the expectation that in order to really advance a partnership or collaboration or opportunity, you have to meet in person. So we've certainly been here receiving, and I'm sure Sheila has as well, more inbound from entrepreneurs in Switzerland or in Latin America and Asia and other parts of the world who are interested in engaging with Mayo and have a little bit of optimism in a challenging year that we can pull something off together to improve healthcare or advance patient care, even if we don't meet in person for 6 months or 18 months or ever. And I'd say that's true of investors as well. And the healthcare venture capital activity is proof that a lot of investment is happening between investors and entrepreneurs who may not meet face to face for a year, and that has, I think, been a positive influence on, I'm sure, many industries. But that sense of detethering from sort of the need to meet in person. But also, I would say what's been exciting for us is we feel a real commitment to advance economic development in Minnesota, Wisconsin, Iowa, Jacksonville in Florida, and Phoenix in Arizona, the communities where we have really big presences. And we can introduce these companies from around the world to these regions and the resources that there are here, the great business schools like at St. Thomas that will provide the talent to help their U.S. office kind of thrive. So it's been a great chance to meet institutions and companies from around the world and also sing the praises of our own communities.
Thanks, Jara. So question from our audience. Sheila, congratulations on progress to date with supporting senior populations who feel and are often left behind as tech innovation is advancing. Tell us a little more about how you will go to market. Is there a Geek Squad for senior scenario? Is this how Lively GreatCall will be positioned?
That's a great question. And certainly we are looking at what is the right workforce to leverage our relationship with seniors. What I will say is that in the work that we've done around virtual care programs or telehealth programs or programs where we know that someone's going to be interacting with an older adult, we have sent our Geek Squad agents. One, we've hired specifically for that work because we recognize the person that loves to come in and hang TVs all day may not be the same person that wants to help an older adult connect a Bluetooth device. That may be a different type of skill set and a different type of, quite frankly, a different type of bedside manner. And so what we've done is hire and post for those positions, specifically looking for, and it's been really exciting to see that we have people within our Geek Squad communities that are leaning into this and want to help serve these communities in a different way. And then what we've done is augment that with the training that our caring center has. And so really helping do that senior sensitivity training and do things like, even simple things about if you're going to do a leave behind, let's think about what that font looks like. Let's not do that in a 4-point font, right? Let's do it in a larger font. Let's have a large phone number for someone to be able to call us. Let's look, if we're in someone's home, let's recognize if someone's getting fatigued or overwhelmed with information. And so we continue to iterate our service offerings. When we look at our Geek Squad agents, and when we zoom out, one of the things I like to think about is our Geek Squad agents are really great at tech support. They do an amazing job. But what Best Buy really has is an infrastructure around the ability to hire, retain, and manage in-home field personnel. And so we see the ability to be very specific about who is the person and what is the job that they're going to do that's going to serve a senior, and making sure that we're finding that right talent, we're training them appropriately, and we're managing appropriately with people that, place that high level of trust with us.
Great, Sheila. Thank you so much. And I think this might be one of our last questions. Jared, what sorts of concerns are you hearing most from healthcare startups that engage with Mayo Clinic?
I mentioned that there are advantages of this sort of decreased reliance on in-person meetings and the openness to connect across borders and across time zones. I think the challenge remains that all entrepreneurs really thrive on feedback and connection, and it can be hard to pick up those cues in a phone call or a video call. And that if you're an entrepreneur, it's a little bit scary not to have the regular conference circuit where you meet people who, you can have 8 conversations in a day that will give you a sense about a potential customer, about a refinement to your offering. That's a concern that we are really pleased to help support our entrepreneurs with, and to try to accelerate those introductions to leading physicians or researchers in a very discrete field, and who might have a very discrete and rare expertise or specialty, so that they can get that feedback more quickly, that they can be connecting with 3 or 4, not just anesthesiologists. We have an anesthesiology device startup, but the anesthesiologists who do the particular procedure that device is trying to serve, so that they get really targeted feedback. So I think finding alternative ways to learn what could work better about a product, what's exciting about a business, what could be stronger about a pitch, that's a source of anxiety, but one that there are a lot of folks, like the folks who organize this call, and Sheila and I, who are excited to work with startups to try to accelerate them and support them in that journey, and find alternative ways to advance their learning.
Thanks, Jerry. I guess we have time for one last question for Sheila. So it's a favorite research interest of mine, which is where is AI in all this? Are we going to see some very interesting AI applications in dealing with this population?
Absolutely. So the third acquisition, that was a perfect tee up. The third acquisition that we did about a year and a half ago was a company called BioSensex. And that was really it was an acqui-hire there, really around data scientists. And so they're doing some work around fall prediction and gait, how you look at someone's walking gait and and what that means for how they may be at risk for a fall in the future. We see AI as an incredibly important tool for taking all this decentralized data and really helping consumers or caregivers engage and harness that data to help them live healthier, be healthier, or recover more quickly and live more safely. So we see AI as a critical component of our future data strategy.
Great, thank you very much.
Thanks, Dan.
So in closing, I'd like to thank Jared and Sheila for their presentations and their time today. I'd also like to thank my colleague Vineet and our partners Clifton Larson Allen and Frederickson and Byring for helping us bring this session to you. We hope you enjoyed today's session. Please remember, in a few business days, you will receive an email with links to the recording of today's session and the registration page for our next seminar on Friday, January 15th, when we will be welcoming Jennifer DeCubulis from Hennepin Healthcare and Dr. Tony Eden from the California Endowment. They will discuss what their organizations are doing to combat negative social determinants of health. Our January session will be delivered at noon Central Time. If you're looking for additional professional development, please check out our executive education website. Thank you for joining us at the University of St. Thomas. Be safe and be well.